All right, guys. Day 5 at Banner Heart Hospital. Um, so, little bit about the surgery and what was happening to me and what happened during the surgery. So, number one is I had a TIA in end of December, and I want to do a shout out to Janelle Singh for saving my life. So I had it's called a transendemic attack, kind of like a mini stroke. Nothing crazy happened, but Janelle said my eyes were all over the place. And of course, I was seeing double vision and crazy stuff like that, right? So, obviously got out of that, went to the cardiologist. They diagnosed me with aortic stenosis, moderate. Okay. Moderate doesn't necessarily need surgery, so they put me on a beta blocker, yada, yada, yada. So what happened after that? So after the beta blocker, pretty much living my life normal. I mean, I'd get some lightheadedness, dizzy spells, a little bit of angina, but nothing too crazy, until the end of May. Symptoms started getting worse. Lightheadedness. I just didn't feel right. So I definitely need to shout out to my good buddy Teresa Lato, who on a ride home from work one day began to scold me in my car. You better go to the doctor. What the hell are you doing? You could sneeze one day and have a heart attack. And very thankful for that. So I went um, into the emergency room. Spent some days here. They did a cardiac cath, and they figured out that all my arteries are blocked. Who knew? I mean, I guess I had some symptoms of angina, but no heart attack that I knew of, right? So we after that, it was decided that I was going to need a coronary artery bypass surgery, most likely a double, and then they were going to replace my aortic valve. Sounds like a fun time, right? Well, the fun time only begins when you try to schedule these outpatient surgery, and I couldn't get a spot till August. I called the doctor and said, yo, I ain't waiting until August. Can't do it, Billy Hoyle. So what happened is I was able to get a spot in July. Still not good enough. I could only work from home. I couldn't go to work just because, driving was an issue. Going to work without feeling dizzy was an issue. I couldn't even go to the casino, right? So it was literally like, who wants to live this life, right? So what we did is I went to the ER again because the chest pain was starting to get worse. Chest pain getting worse, lightheadedness, getting worse. Didn't have any swelling or anything like that. So they put me in here, and they were able to get me a surgery like 5 days later. So I had to stay in the hospital for 5 days to get the surgery that I got. So let's talk about the surgery a little bit. Basically, what they do is they take arteries from other parts of your body, your leg, your chest, and they bypass so your heart can get the blood it needs. Okay. So they were planning on 2 of them, maybe 3. Maybe it was a buy one get one free special. I don't know. So what happened after that is we got the surgery scheduled for Monday around noon. Okay. Now, I don't know how many of you guys have had surgery before, but this one's a little scary. And it's really not scary for me. I'm sure people who would have surgery would be anxious. So the second part of the surgery is they need to replace my aortic valve. It's moderate to severe. It's leaking pretty bad, and it's causing blood flow issues in my body. So I've decided there's two choices for valves. You can get a mechanical, or you can get a tissue valve made with, cow. So I decided to go with the cow valve. With the mechanical, you got to take blood thinners for the rest of your life. And I can tell you what, I've been on this heparin for like 5 days now, and I got bruises in places I didn't think I could bruise. I mean, it's pretty crazy. So, so we went with that, and so let's talk about the day of surgery. It was a 1 o'clock surgery. So basically, you're sitting in your room. People are coming in and talking to you and telling you what to expect. For me, they're going to have surgery on me. If I, for some reason, didn't make it, I wouldn't know, because they're putting me asleep and I'm out. The people that are going to be affected is your family. And obviously I don't, want to leave them. So you go down into the operating room and you're in a waiting area. You're signing a bunch of forms. And then your wife, leaves. They roll you into the emergency, the OR. And, they're great people in there. They're having conversations with you, making you laugh. Next thing you know, you gone. You're gone, you're out. And the next thing you know, you're waking up in the ICU. So you're gone, you wake up. That's it. That's all you know. So I guess, the surgery was pretty complicated. I had some very bad calcification on all my arteries and my heart. And, the reason was why for that is nothing to do with a lifestyle I had. It's a previous medical condition. But, so we'll get into, the surgery in the next episode. But as far as day 4 went, it's frustrating for me, that I only get to walk like 2 times a day. I want to walk like every time I want to walk, but I can't. My body just won't let me. So I'm getting better on that. I felt probably the best I've felt today. The only caveat to that was I was tired, like so tired. That's kind of how day 4 went. Sunday is day 5. So we'll see how that goes. So see you guys then.